Hi, my name is Carolyn Gara-Boivin. I'm an associate professor at the Faculty of Veterinary Medicine at the Université of Montréal, and I am a clinical pathologist for the past 6 years here at the faculty. So I'm the principal investigator of this study, and what we did is we took the product from the laboratory all the way to clinical studies. And our goal was to put the product in different conditions that would really test the limits of Blücare. It started with a phase 1. We actually have 3 phases of the study. In phase 1, what we did is we took the product and tested it in different solutions with a known concentration of red blood cells. We then compared it with gold standard tests that we use in a laboratory or in diagnostics, such as microscopy and chem strips. In the second phase of the experiment, we actually altered the composition of urine in cats by administering fluids. And what we were able to change was primarily the pH, the specific urine gravity, and the protein composition of the urine. In all of these conditions, we were able to detect hematuria at very low concentrations, and this in a repetitive manner. In phase 3, once we had achieved these positive results, we decided to take the product and test it in different veterinary clinics. And what happened is we had cats who arrived with urinary problems, and we tested Blücare alongside their standard urological tests. We were able then to see if a positive result on Blücare agreed with a positive result with the urologic exam. And similarly, with a negative result, we were able to verify if there was a negative result on the urologic exam. This way we could test the sensitivity of Blücare in a clinical environment. So in the second part of the third phase, we actually took Blücare into an animal shelter where we were able to use cats that either had urologic problems or were at risk for urologic problems and test the product in their environment. At the shelter, we were able to verify if a positive case was not detected by Blücare, or vice versa, if a negative case actually triggered a positive result with Blücare. With the diseases present in the shelter, we were able to verify that Blücare properly classifies positive and negative results.
Hello, I'm Jerôme del Castillo. I'm Associate Professor of Veterinary Pharmacology and Toxicology at the University of Montreal College of Veterinary Medicine. I'm the co-investigator in the Blücare project with Dr. Gara-Boivin. The result of the study was that the product, Blücare, was very efficient at detecting very low levels of red blood cells in the urine. What we wanted, first of all, is to provide a very rigorous evaluation of the potential of the test to be used in the clinics. And we used very stringent conditions that put the test to the limits of its efficacy at detecting red blood cells. So with these results that we had, that were with very almost non false positive and false negative detected, we are confident that Blücare will be a great help for veterinarians in monitoring the disease status and the resolution of the problem in diseased cats, and also to detect or to screen cats that are potentially at risk of having urologic conditions that cause hematuria. What we have found is that the Blücare, which is a screening test for hematuria, has a performance that is comparable to the diagnostic tests with which the veterinarians currently diagnose.
Clinical signs of urinary problems in cats can actually be quite vague or not even present at all. And this means that the animal can be presented at a later stage of the disease and can affect the quality of life of the animal or even the lifespan. With Blücare, what's interesting is that we can detect hematuria at an earlier stage, meaning that the veterinarian, the owner, and the animal will benefit for resolving the underlying condition sooner. Certain urinary conditions in the cat can actually be life-threatening, such as urethral obstruction, and it will cause hematuria. With Blücare, we could detect a partial urethral obstruction that is causing hematuria and potentially save the lives of animals or help them at an earlier stage of the disease. Blücare can aid in the follow-up of cats with confirmed hematuria or at risk of having hematuria with various diseases. The benefit of this product is that it can help animal owners bring their cats to the vet prior to irreversible or severe damage to the urinary system. Another advantage of Blücare is that it can be used in the environment where the animal lives. Therefore, it's stress-free compared to a veterinary clinic. This means that the owner will bring the animal to the vet when it's actually necessary and there is a problem that has been identified. This will actually increase the strength of the relationship between the veterinarian and the owner. Another advantage is when the animal is presented, the veterinarian will have better efficiency at choosing a diagnostic test, knowing that there is a urinary problem or that there is hematuria present.
So in summary, Blücare is a reliable and accurate screening and monitoring tool that can be easily used in the household to detect the feline hematuria. We are confident that Blücare will improve the quality of care of cats with hematuria.